listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, we discuss the Extra Help program, which can help make prescription drugs more affordable for your clients. More importantly, we'll share some ways you can verify which clients qualify for some extra help. How to check Medicare Extra Help eligibility for your clients. Written by Roxanne Anderson and Cassidy Potts. Is your client eligible for the Medicare Extra Help program? You could play a huge role in getting them financial assistance with prescription drug coverage and medications. If you'll be discussing prescription drug coverage during an appointment, it's important to verify if your client qualifies for extra help with Medicare. This federal program could mean the difference between your client having affordable access to important medications in their doctor's treatment plan or not. So, what is the Medicare Extra Help program? The Extra Help program is a joint effort by the Centers for Medicare and Medicaid Services, or CMS, and the Social Security Administration, or SSA, to provide financial assistance to those who need it to pay for their Medicare prescription drug coverage and prescription drugs. This program is also called the Medicare Low Income Subsidy Program, or LIS. Enrollees in this program usually do not have to pay for premiums and deductibles for their prescription drug coverage. They may pay some of the deductible if they only receive the partial subsidy instead of the full one. They also do not pay a Part D late enrollment penalty or full co-pays or coinsurance. Enrollees also do not pay more than $5.10 for each generic drug or more than $12.65 for the brand name drugs their plan covers. If your client also gets full Medicaid coverage and is in the Qualified Medicare Beneficiary Program, or QMB, they won't pay more than $4.60 for each covered drug. Once total drug costs reach $2,100, beneficiaries within the Extra Help program will pay $0 for each covered drug. Program members also get a monthly special enrollment period to join or switch Medicare Part D plans. Over the course of a year, someone on Medicare receiving Extra Help could potentially save about $6,200. Some people automatically enroll in the LIS, meaning they don't need to complete the Extra Help application. Here are the individuals who should automatically receive Extra Help. First, you have individuals who are eligible for both Medicare and Medicaid, or dual eligibles. Then, people who receive Supplemental Security Income, or SSI, should automatically get Extra Help. Finally, you can be automatically enrolled if you qualify for a Medicare Savings Program. One thing to note, if a client does not meet the Medicare Extra Help income limits, that does not automatically disqualify them from a state assistance program. The eligibility guidelines for these programs can differ, so be sure to check on a client's eligibility for both types of assistance. To qualify for the LIS or Extra Help, an individual must have Medicare Part A and or Medicare Part B, live in one of the 50 United States or the District of Columbia, have a total savings, investment, and real estate net worth less than $36,100 if you're married, or $18,090 if you're single. Exceptions may apply and the limits may change from year to year. Finally, they must have an income limited to $32,460 if you're married, or $23,940 if you're single. You may be wondering how you can verify the eligibility of your client. It's unlikely your clients will even recognize if they qualify or receive the LIS or Extra Help. Even if they've previously applied for it, their status may have even changed. You're likely more tech-savvy than your clients. It will probably be easier for you to look up their LIS status for them or with them rather than trying to explain to your clients how to do it themselves. If you're ready to verify a client's LIS status, You can do this with CMS or the carrier, online or over the phone. Here are 5 ways to verify a client's Medicare Extra Help status. Use an LIS lookup tool in a carrier's portal if the carrier has one. Call the carrier and ask to confirm your client's LIS eligibility. Call 1-800-MEDICARE, that's 1-800-633-4227, and ask to confirm your client's LIS eligibility. Have your client create and log into their Medicare.gov account to check if they qualify for the LIS. And finally, ask your client to use the Find Out If You Qualify tool available on SSA.gov. Please note, these tools are available pre-enrollment to check a client's eligibility prior to enrollment. During appointments, agents should confirm whether their clients qualify for the LIS before enrolling them in a prescription drug plan. By doing this, you'll be acting in your client's best interests, helping them to afford the medications they need and even saving money on their prescriptions. What better way is there to show your clients that you're the right agent to get the job done? If your client's Extra Help status changes, they should receive a notification from CMS or the SSA through the mail. The color of this notice will vary depending on the purpose the notice serves. For a full cheat sheet on each notice and what they mean, see the full article in the episode notes. And what about everyone else? Anyone who does not automatically get the LIS should complete the Medicare Extra Help application if there's even a chance they're eligible for it. If you think your client may qualify for this program, you can help them apply for it via the Social Security Administration's website. Clients can also call or visit their local Social Security office to apply. Individuals who need further assistance can contact their State Health Insurance Assistance Program, or SHIP. One of the most important ways an agent can serve their clients is making sure that they are aware of the programs that can help them. To learn more, check out the full article in the episode notes. That's all for now. Thank you for listening and helping your clients find affordable drug coverage. We'll see you on the next episode of the Agent Survival Guide.
The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson and Cassidy Potts. Script adaptation and recording by Jeff Snyder. Podcast design by Urban Rivera. With production by me, Sarah Ruppel. Like what you hear? Follow along with our show wherever you like to listen.